Welcome, everyone. My name is Dara Ray, and I am the president of Learn, a nonprofit organization here in Boise, formed to provide free quality education on aging and caregiving related issues to the community. And this is one of the sessions in our very first inaugural community education series. And we're pleased to bring you today the ABCs of Medicare and Medicaid, sponsored by Life Changes Elder Care Consulting. And our educators today are Teresa McCully from Silver Key Benefits and Kristen Tracy from Blue Cross of Idaho. So I'll introduce them in just a moment. I want to share with you, if you're not familiar with Learn, what is Learn? I mentioned we are an Idaho-based nonprofit. It stands for Lifelong Education and Aging Resource Network. And we have a mission to provide this quality community education on retirement and aging related topics in the areas of health, wealth, lifestyle, and caregiving. And we are a membership organization comprised of professionals across the valley who are committed to sharing this information free of charge to our community, to general members of the community, as well as other professionals, as well as partners across the valley. So we have members and partners who help us make our mission a reality. We are also a recognized leaders network of the Society of Certified Senior Advisors, one certifying body of many that certify and ensure that the professionals that you work with in the aging and caregiving industries are certified and vetted and qualified to provide you with the information and the services that you seek. And so we do encourage you to make sure that the professionals you're working with are educated, licensed, and are certified in their appropriate area. We are committed to providing this information, but it is being provided for general informational purposes only and should not be considered legal, financial, or health advice. We do ask you to please consult your own legal, financial, healthcare, or service provider before taking specific personal action based on this information. All right. So thanks again to Life Changes Elder Care Consulting and Dee Childers. I look like Dee Childers if you're looking at my name on the screen. I am not Dee. I'm logged in as her today. She is our community education chair and was honored to sponsor this event. Life Changes Elder Care is a care management organization who offer the professional help you need as family caregivers to manage and support the needs of those you love. And I love her explanation when she says that she and her staff often are called the hired daughters. They coordinate the care of loved ones and family members and help manage and navigate the challenges of caregiving for their clients. First, it is my pleasure to introduce Teresa McCully from Silver Key Benefits. Teresa is an insurance broker with a real passion for helping people. Her natural draw has been to equip folks nearing or already in retirement with clear and objective information regarding their options. She likes to teach her clients how to create level medical costs, cover funeral expenses at a discount, and protect their nest eggs from going to zero before they do. Her goal is to help her customers make sure their insurance dollars achieve the greatest level of peace of mind possible. Kristen Tracy has worked under the canopy of healthy aging for over 20 years and is currently the Government Programs Engagement Manager at Blue Cross of Idaho. Kristen is a licensed social worker in the state of Idaho and has also earned her MS in gerontology. She has experience directing federally and locally funded grants, specifically in the areas of anti-poverty. Kristen's current role is Government Programs Engagement Manager at Blue Cross of Idaho, which allows her to work directly in the community with community members. So with that as our introductions, I am going to switch right into your slide, Teresa.
Thank you.
And turn it over to you to share with us the ABCs of Medicare.
Thank you so much. And that was a wonderful bio intro. Thanks, Dara. I'm so glad to have everyone on board. I'm sure this is something that, everyone is interested in learning about because we're all hopefully someday going to be eligible for some Medicare benefits. So I'm going to actually break this down into about 4 different sections. We're going to talk about timing. We're going to talk about the options, the cost, of course, and then the benefits that are provided or not provided and how they're provided to you. So that's kind of the overview of how we're going to move through this. So here on this first slide, you see everything in blue is original Medicare. A, B, and D for drugs are all part of original Medicare. And so that's kind of how you can navigate this little slide here. But as you kind of glance at that, I'm going to go through a typical scenario. Everybody is an individual, which is why I really recommend you meet with me or another person that knows what they're doing, because there are always very specific individual things with us that we want to make sure we're addressing. But typically, the timing period, or otherwise known as election periods, there's three of them usually that we talk about: initial, open enrollment, and special election period. So of those three, the initial election period is just like it sounds. It's the very first time you're eligible to get onto your Part B. You could have A as soon as you get on, as soon as you turn 65, you could have Part A and not take Part B, because let's say you're on your spouse's group plan, which is often the case. So you can actually push off your Part B until you're actually ready to get the rest of your Medicare. And you might want to do that because though Part A does have a cost if you didn't work long enough to get Social Security, Part B has a charge that you can offset for however long you have creditable coverage with, group care or whatnot. So that's something that's interesting to know about that initial election period, that you can put off Part B as long as you have creditable coverage through another entity. That time frame is about 7 months. So 3 months prior to your birth month, the month of your birth month, and 3 months after your birth month, unless you happen to have a birthday on the first of the month. And then you would be pushed into the month prior. So if you were a January 1st baby, you would be looking at enrolling in your Medicare in December. So that's something that's really important to know for anyone who has a birthday on the first of the month. Open enrollment period, or election period, is that annual enrollment that we can do every year, where we look from October 15th through December 7th. And you can look and they'll give you all the information, all the details of the next year's plans. And you can work with someone like myself to help navigate which one works for you. And you can make your decision on that on October 15th. And then on October 30th, change your mind and enroll in something else, and even enroll again, as long as you have made your election before December 7th. The last enrollment to get processed will be the one that you are enrolled in after January 1st. All of those plans become effective in the calendar year following. So that gives us a little bit of time to do that overview. And then there is special election periods. And those are for when you have a life-changing event, you move, something happens, then you can make a change mid-year according to your special election period. And so that can be, usually it's about a 60-day window for when you move and when you register your new address, that you'd want to take advantage of that special election and get a new plan for wherever you're living currently. So that's kind of the timing of Medicare. And then we're looking at the options. So if you look at my slide, you've got Part A, which covers your hospital. And it does have some out-of-pocket costs, but as I said before, as long as you work long enough in Social Security, you're not going to have a charge for your Part A typically. Part B, whenever it is you do decide to get on Part B, if you take Social Security at age 65, Part B election will be automatic unless you opt out. But if you decide not to take Social Security at age 65 and you want to wait and offset and earn that 8%, which I highly recommend if you can, then you'll have a little bit, you'll go ahead and enroll in that Part B when the time is right for you. But that does come with a premium. A monthly premium this year is $148.50. And with Part B Original Medicare, they cover you really, really well, but they leave you with 20% co-insurance. So basically Medicare picks up 80% of your tab after you've paid your $148.50 and you've paid your small $203 annual deductible. And that's actually pretty darn good insurance, if you ask me, compared to what I'm paying for what I get. But the problem with that Part B, leaving us with 20% co-insurance, you see the next line, there's no maximum out of pocket. So there's no ceiling on our liability. So you go and get $100,000 surgery on original Medicare for $148.50 a month, you're going to have to pay $20,000 of that. And that is why we even look at buying any other insurance on top of original Medicare. A lot of us don't have that extra cash lying around. And if we do, hopefully we're saving it for long-term care. But looking below, you can see, hold on a second, drop my note here. You can see there that the Part C in the pink there, we've got, I see it says option 2, but I'm going to go to there first because Part C, this is we're going A, B, C, makes sense, is an advantage plan. And those advantage plans actually encompass all of the original Medicare parts, A, B, and D, all under one roof. They take over original Medicare's billing. They do all the billing, and it's all under one roof. And so a lot of people are really familiar with these. They mimic group healthcare quite a bit, where you might get lower premiums on a monthly basis, but then you're going to have out-of-pocket costs as you bump along. So they'll have the co-payments. Maybe every time you go to see your doctor, you'll have a small copay for different procedures and whatnot. They'll have different copays, and they also have co-insurance. And oftentimes I see that their co-insurance is 20%, just like original Medicare. But the nice thing about the Advantage plans is I believe there's two really nice benefits about Advantage plans. And one is that you can find plans that enhance the benefits. So original Medicare covers only things that pertain to you're sick and you need health care. It's nothing preventative. We're starting to see some things trickle in, but really it's not about preventative. And so these Advantage plans have come along and said, hey, if we can add some preventative benefits, maybe people want to join our plan more. So by golly, we see a lot of competition in the market on these extra benefits. So from year to year, I'll see the trends. This year, the trend is all about dental. So we're seeing much more robust coverage on those extra benefits when it comes to dental and some hearing benefits this year. A couple years ago back, it was all about the gym membership. I don't know if anyone's familiar with that, but that was a really, really very popular extra benefit, which is a preventative, right? It keeps us healthy to go to the gym, and get our teeth checked. Medicare doesn't cover that. These Advantage plans have come in and started to sort of fill those little gaps. The other thing that, I really do like about these is that not only do you have those extra benefits, but you have your prescription drug plan kind of tied together. It can be a pro and a con, depending on how you look at it. But oftentimes my clients feel really good and comfortable knowing they just have the one card for both their drug plan and for their healthcare plan. And so those are some really nice benefits about being on those Advantage plans. Some things I want you to be really aware of on those plans, however, is that they are networked plans. And I'll get a little bit more into that in a minute, but it's something to be very mindful of. You would have to be very careful what kind of plan, whether it was a PPO or an HMO, and how to navigate those networks. And it's really important to look at these every year, because even if you never change your plan will change on you. And so it really is important to do a review at least every year. So that's a little overview of the Advantage plans, and I'll get into the costs here in just a moment. But let's jump over to the green side where it says the Medigap plans. So the Medigap plans are standalone plans that they basically come in and they help you pay that 20% out of pocket that Medicare leaves to you. Those Medigap plans, especially the Plan G, which is the one that we typically see people purchasing, it really makes the most sense for cost-wise, is to get on a Medigap plan. And the Plan G after meeting that 203 deductible, which is this year's deductible, that plan, your monthly premium or your total annual premium plus that small deductible, that is your out-of-pocket cost for your health care. And there is no maximum out-of-pocket because they don't charge all those little nickels and dimes within the plan. So you're paying a higher premium per month, but then you don't have any out-of-pocket when you go and use your health care. These don't have networks, which is a very, very big benefit. I find that networks are probably the most difficult part of choosing a plan from year to year. And I have had clients, unfortunately, that we're looking at a savings of upwards of over $1,000, let's say, on the cost of their medications. But the new plan with the better cost for meds doesn't have their doctor in the network. And then they're having to decide, do I love my doctor enough to pay $1,000 more for my out-of-pocket costs for my meds? And that's not a place I ever want to be. And I don't really love it when my clients have to make those tough decisions. But that is a big difference between the two sides of the fence. Being able to be on a Medigap plan with no networks can really be beneficial in the overall long-term care and costs. It does not include any of those extra benefits. So on the Medigap side, something that's really easy to remember is if original Medicare didn't pay 1 penny of it, then my Medigap won't pay the rest of it. So that's a really good way to know what will Medigap cover and what won't it cover. Whatever Medicare pays a portion of, your Medigap will pick up the remainder, especially on that plan G. And then as you see, it's separate from the blue prescription drug plan. And that is because we look at a totally different plan to make sure you're getting the least expensive costs for your meds, but not having to touch your healthcare from year to year. And then lastly, about the Medigap plans is that because they are not networked, you can go anywhere in the country to get your care as long as they're Medicare, the doctors take Medicare. And that can be huge when you have a very special need or special situation or issue. You can go to a specialist in Kansas that specializes in that particular procedure, and your insurance is going to cover you. So that's another really nice thing about the Medigap plans. So let's see, I wanted to talk about the different types of care. And my paper flew away. My windows are open because it's beautiful and my paper flew off my table. So in looking at the costs, will you go ahead and scroll for me down to the next slide, please, Dara? Thanks. Perfect. So here we see, and usually I break this out like little by little, but you're going to get the whole kit and caboodle at once. But if we broke it out little by little, you've got HMO on the far left and Medigap on the far right. And then in between, we have a PPO and we have a PPO ship. And just to tell you what that PPO ship is, on the Advantage plans, like I said, they have these co-pays, co-insurance, little nickels and dimes. The biggest nickel and dime that they usually have on those Advantage plans are with the hospital stays. Those are where we're seeing the hundreds of dollars per day out of pocket. And so a SHIP stands for Senior Hospital Indemnity Plan. And basically what that is a small standalone plan that we attach to an Advantage plan so that our clients are paying very little premium, but getting really good coverage, especially where it counts on the hospital stays. So on the far left, the HMO is a health maintenance organization. Those are the most restrictive as far as the networks go. And you can see that premiums are often the lowest. We've actually seen premiums that go from zero, can't get lower than zero, on upwards to over $200, depending on which company you go with an HMO. And as you go across towards the Medigap side, the costs typically do also increase. Medigap plans being the most expensive typically. But I do see HMOs out there that are actually more expensive than a Medigap plan for a 65-year-old. So don't be fooled per se, but generally they are more. The PPO being a preferred provider organization, They're very similar, HMO and PPO. The only difference is an HMO has a bullseye and in-network. And if you go out of that bullseye, you have no coverage. A PPO has the same bullseye in-network coverage, great discount. If you go out of the bullseye, you still have a discount. It's just not as good as the bullseye in-network. So those are the differences. PPOs will allow my clients more options as far as who they can go and see. They just know that they might have to pay a little bit more to see their, best buddy that, they've known forever. So that's the difference between the HMO and the PPO as far as networks go. That MOOP, the maximum out of pocket, those are typically highest on the HMO side because they're taking in the least amount of money. They're probably going to give you the most amount of maximum out of pocket. And we're seeing things from just about 4,000 on up to 10,000. If you are in network on a PPO, you'll have a 10,000 ceiling of liability for that in and out of network combination. So that maximum
is that per year, Teresa?
Yes, that is per year, and it starts over. And not all of your costs, so the nickels and dimes that you pay out as you use your insurance, not all of those dollars go towards the maximum out of pocket. So I call it a soft ceiling. But as you see, as you go across, the MOOP goes down. So Medigap, as I said before, on a plan G, you pay a monthly premium after you've met your annual deductible, which is a $203 deductible this year. It's gone up a whole $5 from last year. It's really a nominal annual deductible. There is no more liability. So when you look at the total annual cost for a plan G, right now, we're looking at less than $2,000 for your hard costs on your plan G, including the $203 deductible and including monthly premiums, average monthly premiums for that drug plan. That is that standalone drug plan that I talked about. We'd add that in there and still we're looking at less than about $2,000 a year. Whereas on the Advantage plans, your hard cost might be very, very little. In a good health year, you might get away with only spending $150 for your stuff. But you have that liability. If you got in an accident or if you had, a health issue, you are liable for, upwards of 4,000 and up. So there's that kind of which side do I want to risk being on for my health and my situation? Do I love to travel? I might want a Medigap plan because I can take that anywhere. If I'm a homebody, I don't care. I see the same doctor every day. HMO might be just fine. And then we look at risk. Basically, that HMO higher risk only because they're more restrictive on networks. So you can easily accidentally go out of network and be charged full price. They have the higher maximum out of pockets. So that's an issue. And because they change every year on you without you making any changes, there is that added risk of you got to be on top of your plan and really be paying attention to what the changes are. So you're sure that you want to stay on that plan for the next year. Whereas you see, as you move across towards Medigap, the risk goes down. You really have very little risk on the Medigap side, other than I need all preventative care. And then you would be not very happy on the Medigap side. There was one thing I wanted to share. The Medigap does offer worldwide coverage. So if you are a world traveler, then a Medigap is really viable. And so let's talk just a little bit about cost. I just want to nutshell that. The Advantage plans, they vary from $0 premium on up to over $200 premium. We will always pay our Part B premium unless Kristen has a Medicaid issue, and then you can get rid of that, but that's a Medicaid thing. So that's important to understand those costs, those hard costs, and then those benefits being necessary or preventative. It's very important, and understanding what your out of pocket will be there. And then there was one more thing I wanted to say, and I was thinking about it and I didn't put it on my notes. But that's about it in a nutshell. If there's any questions that you have for me, unlike what Kristen's going to talk about, where if you're low income or if you have low dollars available, you'd be eligible for Medicaid. You can actually get into a tangle where you make too much money. And that's called an IRMA bracket. And it's an income related Medicare adjustment where they will actually charge you more for your part A and B if you actually make too much in retirement. And so right now, the bracket, just to put it out there for you, is 85,000 or less for an individual income and 170,000 or less as a couple. Then you'll be in that 148.50 a month bracket. Anything above that, then you'll be paying higher premiums, and they bracket those as well. So if you have any questions in particular about those IRMA brackets, I can help you with that as well. So if there's not any questions for me now, you can certainly email me. I'm sure Dara has my information there that she'll be sending out, if not already out there. If you want to take down my phone number, it's 208-284-3566. You're welcome to text me and I'll let you know. I love questions. I always say, you just shoot them at me, because if I don't have the answers, I'll go find them and then I'm a better agent. And so I really do like a lot of questions. So bring them on.
So I'm just going to lob you one and see what you think, Teresa. I know there is no typical, right? There is no right answer. But if you think about a person's situation and choosing between traditional Medicare with Medigap and a prescription drug coverage, which would be A, B, and D, or choosing an Advantage plan, which is C, is there like a profile of person that you see attracted to one or the other? Is it based on their risk tolerance, or what do you see as an agent? And do you have any guidance around, if this is more important to you, consider that, versus if something like that?
Right. Yes, absolutely. In fact, you reminded me what I wanted to mention, and that's
Perfect.
with that initial enrollment period when you're first eligible for Part B. On a Medigap side, you would have what they call a guaranteed issue. They can't ask you any questions, that's if you start on a Medigap plan first out of the gate. If you decide out of the gate to get on an Advantage plan first, then later on, as your healthcare started to deteriorate and you realize, gosh, I'm meeting my maximum out of pockets every year, I'd be better off on a Medigap plan. Well, to jump that fence, you'd have to health qualify because you waited after your initial enrollment. So that's really important to understand why I do lean a little bit more towards Medigap on the first go, because if you start on Medigap and you decide the next year or 15 years down the road, gosh, my neighbor has all these wonderful things and they're paying $0 and I want to try one of those, that allows you and it buys you what's called a trial right period. So you could jump onto an Advantage plan, dabble on it, check it out. If you decide it's, for you, you can stay on them. But if you decide, oh, I made a mistake, you can always jump back to your Medigap plan. No questions asked. So
how long is that period?
1 year, and actually it's 11 months because you have to do it the month prior that it needs to be reinstated. So it's actually 11 months that we would be able to dabble on the Advantage plan side and then hurry back to your Medigap plan should you decide that it wasn't a good option. And I've had people do that, and it's been a huge saving grace that they did that because their health took a turn for the worst, and they had a lot better coverage. So what I typically will say, again, just generally speaking, is if you can afford comfortably the premium for a Medigap plan, which right now for a 65-year-old is anywhere between about $125 to $145, depending on the company that you go with. These are federally regulated plans. So it's like buying Coca-Cola from the grocery store. Depending on which store you buy it from, they're going to charge a little bit different prices for the same Coca-Cola. Same exact thing with the Medigap plan. So that's, that range of $125 to $145 a month, plus the prescription drug plan, which right now ranges from $750, on up, depending on what kind of crazy meds you're on.
$7.50.
$7.50 is the lowest premium prescription drug plan out there. That's standalone drug plan. Yeah. So I will say really point blank, if you can comfortably afford the premiums on a plan G, why wouldn't you go with the plan G? Because when you really need your insurance, it's going to pay really well.
Yeah.
So it's worth the premium if you can afford it. And that's right out of the gate. For people who are really on the fence and they can kind of afford it, I still encourage them to start on the Medigap side, because it buys them that trial right period to check out both sides and not worry about their health being an issue, a kick out issue. And then for Advantage plans, of course, everything comes from a budget. I understand that. I mean, you can't make money grow when you're retired at that point. It's very difficult to create more income. Unless you speak to me. But with the Advantage plan sides, I can't beat zero. And it does have a lot of extra benefits, which really helps supplement people's income. If they're not spending $1,000 on their dental or their new glasses or their gym membership, those little things really can help on a monthly budget. And so, if I'm looking at someone that's really having a tough time making ends meet, but they don't qualify for Medicaid, that is what those Advantage plans are for. That's really what they're intended for. So that's in a nutshell how I'd navigate those.
Thank you.
Thank you.
Any other questions for Teresa before we shift our focus a little bit towards that Medicaid side and how Medicare and Medicaid play together? All right, hearing none, I'm going to stop sharing, Kristen, and you should be able to share from your screen.
Okay, can you guys see that?
We can.
There, all right. Okay, great. Well, Teresa, thank you. That was a great presentation, and Dara, thank you also for the introduction. That was a great setup, really, Teresa, for what we're talking about today. So thank you. We are going to be talking about the concept of coordinated care under the canopy of managed care. And really the population that we're speaking about today are dual eligibles. So dual eligibles in the state of Idaho are individuals who are on enhanced Medicaid, and they're also on Medicare. And when you look at that population, typically those are individuals that have chronic health conditions. They may have a disability, or they have an incredibly limited income. And so this is really the population that we're going to be talking about today. In the state of Idaho, I think we have about 30,000 dual eligible individuals, and that count is growing every day. So we do have new people moving in, but some people also reach that level of whether it's with a chronic illness or a disability, or it could be age-related. Multiple factors and income factors play into that eligibility. So I'm going to forward my screen. This is just a quick disclaimer. We do not discriminate at Blue Cross of Idaho. And what we're going to be talking about, these plans are a zero premium plan. So that's really an important piece to remember. There are currently 2 plans in the state of Idaho that are authorized to, or that have contracts with the Department of Health and Welfare to deliver a Medicare Medicaid coordinated plan. And those 2 plans are Molina Healthcare and Blue Cross of Idaho. So again, these plans are for individuals that are dual eligible. And we also partner directly with the Department of Health and Welfare. They have really strong oversight of both of our programs, Molina and Blue Cross of Idaho. In fact, my director is in contact with Department of Health and Welfare on a daily basis, as I'm sure the same with Molina. There's just a good partnership to ensure that we are delivering a strong product for duals and that they're having their healthcare needs met. And some folks kind of wonder, well, how did this all come about? And I probably should have said this a little bit earlier before, but back in 2003, the state legislature asked the Department of Health and Welfare to start to research some options for dual eligible individuals. They really wanted to see their health outcomes increase and those costs associated with that, with the treatment decrease. And, you know, that's a high bar. So the Department of Health and Welfare did their research, and they looked around and they were seeing what was working in other states and what could be replicable in Idaho. And they came up with this concept of the Medicare Medicaid Coordinated Plan. And really what that does is it takes Medicare and Medicaid, which were two systems that are great systems, but they originally were not designed to speak together and work really well together. It takes both of those systems and it puts them under one roof, either Blue Cross or Molina, and we administer those benefits. And so that's why this partnership slide is so important. You know, we work with the Department of Health and Welfare really, truly as partners. And even though Blue Cross and Molina are working competitively to capture as many members as we can, we both firmly believe that this is the best route for Idaho's dual eligibles. And we just want to make sure that people are educated, that they know what the choices are, and we just want to see people in a Medicare Medicaid coordinated plan. So are there any questions so far? Okay, I'll keep marching on, but if you do have questions, just let me know. So we're going to talk a little bit about where we got, or how we got here. And we'll talk about the Idaho Medicaid Plus and the Medicare and Medicaid Coordinated Plan. And sometimes on this screen right here, it talks about, it says HMO DSNP, but really that's the Medicare Medicaid Coordinated Plan. So that's what we just talked a little bit about, that it includes everything. It includes A, B, and D. So you've got Medicare A, which is your hospital. You've got B, which are your doctor's offices and services, outpatient services. And D, which is your drug, your prescription drug. And then Medicaid is also rolled into that. And this plan was first launched in Idaho in 2014. So we've been running, you know, a Medicare Medicaid coordinated plan for over 7 years and have learned a lot along the way. And then if you look over to the right side of the screen, there is the Medicaid Plus, Idaho Medicaid Plus. And those are for duals. That's a plan for duals that they don't really want to give up they don't want to move into a Medicare Advantage plan. They don't want to go into that Medicare Medicaid coordinated plan. They just have their Medicaid coordinated through either Blue Cross or through Molina. They do receive a care coordinator, and it's great to have someone on the inside track looking at that. But really, I think the best plan and a really good way to illustrate this is to look at the MMCP plan, which is on the left-hand side of the screen, as the Cadillac. It is definitely the one with all the bangs and the whistles. It's a plan that's going to get our duals the best health care. It will identify gaps. They'll have someone to advocate for them. And then Blue Cross or Idaho Medicaid Plus is sort of the, gosh, I guess they call it the Kia of the car world. It's a good plan, and it'll get our members there, but it's not going to be probably as comfortable as the Cadillac. It won't have those heated seats and great suspension and all of that. The other analogy that I've heard is that the traditional Medicare and Medicaid services, the system like that, when the members are really trying to navigate both systems, that was called the Pinto. And it was just tough for members to navigate. So this is really what we're looking at in the state of Idaho, is this movement towards managed care for our dual eligibles.
So one question, Kristen, just to make sure I understand, the completely coordinated care is the special needs plan. On the Medicaid Plus plan, your client or the individual would still have their traditional Medicare and traditional Medicare drug or whatever they're doing, and then they'd have Medicaid, and they would.
Yeah.
Okay. Thank you.
Yes, and there's a couple of ways they can do that. Dara, I think that's a great question. A lot of times people will choose a different MA plan. So they may have a plan with, United for MA, and then they'll have their Blue Cross of Idaho or Molina Medicaid card. So
so they could even do a Medicare Advantage still for Medicare. They just aren't tying it together. So they can go either way on the right-hand side. Okay, great. Thank you for the clarification.
Yeah,
Do you
very,
have-
yep. Oh,
Do you have
Donald?
to have both at the same time, Medicare and Medicaid?
Yes, you do. In order to qualify for this plan, yes. Yeah.
What if you
We'll
don't,
get into.
well, what if you
I'm
don't
sorry?
need Medicaid just yet?
Well then, yeah, you just would not qualify for this plan. Does that make
Okay.
sense?
Yes, sort of. I got here late, sorry.
Oh, okay. Well, we haven't even got to that part yet, Donald, so we'll get there. And
Oh,
yeah,
perfect.
keep asking questions because
All
I
right.
appreciate that. Yeah. Yeah, but really the big thing that we want duals to know is that there are a lot of choices. And that was one thing that was really important to the legislature because we just know Idahoans and Idahoans want choice. So there are a lot of choices, but we're here to really help educate too. That's our goal. So that's what we're trying to do.
Oh, absolutely, absolutely.
Yeah, and this is really where we are, Donald. You know, what is the eligibility criteria for members? So they have to be enrolled in Medicare and enhanced Medicaid. There are two levels of Medicaid. There's basic and then there's enhanced. So enhanced is just kind of what it says it is. It's a little bit of a step up because of some chronic health conditions, a disability, or you know, potentially very, very limited income. So it's a certain segment of that dual eligible population that has a lot of high needs and unfortunately high medical costs too. So that's who this plan serves. We also serve individuals who are age 21 and older, and they have to live within a designated service area. So I'm going to show you the counties that we're in right now. And the black counties, well, actually all of the counties right now that you're seeing, you'll see some in blue and some in black. Blue Cross is in all of these counties. I mean, we've been here a lot longer than Molina, so we've covered a little more counties. But the ones in the blue, so the ones in the black, those are the counties that Molina is serving also. So I wanted to be very clear. There are 30 counties representative. Molina serves in 21. Mary, is that right? Yep, she's nodding. Okay, great. I tried to make it easy, but I knew I would mess it up when I was saying it out loud. So Molina serves in these in the black 21 counties, and then Blue Cross serves in the rest of the counties, in all of the counties, the black and the blue. So there's good coverage out there, and you can see that we're growing slowly. You know, I think everyone's goal is to ensure that duals, wherever they live in the state of Idaho, could have the option for the Medicare Medicaid coordinated plan. But it takes time, and we're making sure that we're delivering really good services and that we can expand to continue to offer really good services. And hopefully.
And I'm correct in my understanding that Blue Cross and Molina are the two providers in the state of Idaho today for this dual plan, correct?
You are correct. For both the MMCP and Idaho Medicaid Plus. Yes.
Yep. Thank you.
Yeah. And here's just a little bit more of that overview of the program benefits. MMCP, you will see right here on the left-hand side. So again, we're talking about all of those medically necessary and preventative services covered under Medicare, with parts A, which is hospital, B, which are doctor and outpatient, and D, which is the drug. And then we've got those extra components in there because of Medicaid. So we have behavioral health, including the home and community-based services. Nursing home, we do have the A&D waiver services that are covered, which are really important. Personal care services, and then care coordination. And then over on the right-hand side, Idaho Medicaid Plus. This just basically tells you, you know, that we cover everything with that is under Medicaid. So we take care of some of those extra costs that Medicare doesn't take care of.
So that doesn't include like a Part G?
A Part G.
Well, Medicare Part G like covers deductibles and the things that aren't covered under A and B.
Oh, okay. Well, so
you're thinking, I hate to interrupt, but I think that you're thinking there's a difference between parts and plans. So Part A, B, and D, and then there's a Plan G. Okay, so the Plan G is a Medigap plan, And most people who need Medicaid can't really or don't or really shouldn't afford something that has such a high premium. So you can have one, but it's not usual.
Okay.
And actually, I know, Donald, you joined us a little bit late. Teresa went over the traditional Medicare and the Medigap plans and Medicare Advantage versus the Medigap plans in the first half of the meeting, and we'll get that posted out on the website within the next 3 to 5 days. So you can go back and get that piece of it too.
Okay, great. Thank you.
Great, thank you. And both Molina and Blue Cross have those additional benefits that Teresa referred to earlier in MA plans. A lot of those preventative benefits. So you'll have things like, and this is just a snapshot, eyewear, hearing aids, gym memberships, telehealth, a nurse advice line, transportation, over-the-counter benefits. I know both plans have a catalog that members can receive, and they receive an allowance essentially that gives them a credit for every quarter, and they can use that catalog and purchase things like Band-Aids, Depends, incontinence supplies, allergy medicine, toothpaste, denture, all kinds of things, and it's drop shipped to their door. So, and I think even with Molina, they've got a debit card that they can actually go in and utilize that. So there's just a lot of great extra benefits for duals when they can check out these plans, and that's some things that can really help with some cost savings long term also. But obviously there's a lot of things in there that can help increase our health outcomes, and look at that from more of that preventative side. So I think Teresa really laid some great groundwork on that. And I would encourage you, if you know anyone, to either get in touch with Mary with Molina or myself with Blue Cross, and we can tell you more in depth about our plans and what they offer. But there are a few carve-outs that the Department of Health and Welfare decided to keep. And these are services that they had when they had traditional Medicaid. So what our members will do is they'll still use their Idaho Smiles dental benefits. Many Medicaid members have an Idaho Smiles card, so they'll continue to utilize that. Their developmental disability waiver benefits, things like targeted case management, all of those still stay intact. And that's a real a benefit and a win for those individuals who are in the disability community, because they don't have to start all over with those services. Non-emergency medical transportation benefits still stays intact, and the Department of Health and Welfare still oversees that contract. And then intermediate care facility services, they're still under the canopy of Health and Welfare. And then we're going to talk really briefly about why you would really want to join the fully integrated plan. And that's care coordination. That's truly the crown jewel of all of this. And that really comes down to a care coordinator. Care coordinators are individuals who members are assigned to, and they actually serve as the point person for the member. And the three things that I really like to think about with care coordination is that they help the member navigate the system, they advocate for the member, and they ensure that there are no gaps for that member. And that's the most important thing I'd like for you to take away today. It's just to know that if you've got someone who is a dual eligible member and they sign up for an MMCP plan, they will have an advocate, whether it's with Molina or Blue Cross. They're going to have somebody right there in the system that understands Medicare, Medicaid, and the system that they're working within, and that will help coordinate all of those pieces. And that's a huge administrative burden taken off the member or their caretakers. So, care coordination is a collaborative effort of nurses, social workers, counselors, and qualified health professionals, and clinician support staff to help support our members. It's a patient-centered approach, and we work with members by meeting their specific needs and conditions. So one thing that's really important with care coordination, care coordinators sit down with the members. They haven't been able to do so because of COVID this last year, but pre-COVID, and we're hoping to get back to that model very soon, where they can sit down one-on-one with the member and their family members if they choose, or those caretakers, and work on a plan with them, identify their health care goals, and help them meet those goals. So it's a really nice thing. And If members don't want that extra contact, they don't have to have it, but we highly encourage members to do so. And we have seen that the healthcare outcomes just improve over time. So I can't say enough about care coordination. I'm going to switch to our next. So really, what does the care coordinator, this is one of my favorite slides. This is a little diagram that just sort of shows the member, the you is supposed to be the member, and their family, or maybe their caretakers in the middle of that circle. And the care coordinator's right up there at the top, and they just help them navigate their primary care provider. They can help with those appointments or talking to specialists and making sure everything is all in alignment. They can work with home care providers, family members. Maybe there's some sticky family situations, and they can just help with that. Mental health, behavioral health is definitely covered under these plans, and so that's a service that we also coordinate. And then those transitions of care. You know, oftentimes people will transition from to a higher skilled environment when they require that level of health care. So we can also help with that. Any questions so far on care coordination and what they do? These plans are also very interested in continuity of care. So when we have members that come to our plans and sign up, we are an HMO. And as Teresa had talked about that bullseye, we've got that bullseye. So we have a network of doctors. And we want to ensure that that member has continuity of care. So if they have a they sign up for our plan and they've got a doctor that's not in that bullseye, we will continue to pay that doctor for 90 days for whatever they were seeing that doctor for before they signed up. And we'll work with that doctor to see if we can contract with them to get them in network. And if for some reason that healthcare provider decides not to join, then the care coordinators will help that member find a provider that's comparable and within the network, within that bullseye, so they don't have any out-of-pocket costs. And I think that that's a really important service that we offer. That's part of that navigation piece. And as Teresa was talking about, some of those networks and formularies, it's just those are the really important things that you want to look at when you sign up for these plans. And it's true with MMCP too. You just want to make sure that your doctors are a network and that your drugs, where they are on the formulary too. So those are important things to look at. Any questions? Okay, it's also very easy to identify. I know we're throwing tons of acronyms and new terms at you. MMCP, TBSMP, IMP, there's lots of stuff going on. So we just thought I'd show you really brief cards. Now, this is just for Blue Cross, and Molina has made theirs very clear too. I don't have access to their stuff, but I thought I'd show you Blue Cross's really fast. Right over here on the left-hand side, it clearly says the True Blue Special Needs Plan, which is sort of the, that's our trade name that we use in the public. But it does says HMOD SNP, which is the Special Needs Plan. So you can see that, and it does have the Medicare logo down there at the bottom. And then over to the right-hand side, that is our Medicaid card, or our Idaho True Blue, or our Idaho Medicaid Plus. Yeah, Idaho Medicaid Plus card. Sorry, gee, talking too fast. And we've got that clearly labeled there too. So it's just important, I think, for members to be able to recognize, and for the general public to know too, that hopefully you can see what an individual has.
And question, Kristen, on the Medicaid Plus. So I know that are Molina and Blue Cross the only two that do Medicaid at all, or is it just the dual eligible piece? Is it Medicaid at all? Is Molina and Blue Cross?
Well, and that is such a great question, Dara, and I should have said this a lot more clearly at the beginning. So dual eligibles is, if you think of it as a canopy, so those individuals that are dual eligible, and let me go back to my slide. So if they are enrolled in Medicare and Enhanced Medicaid, they're 21 years old and they live in the designated service areas, that defines who a dual eligible is in Idaho. And then they have two choices. They can either choose, if they're interested in coordinated care, they can either choose the MMCP or Idaho Medicaid Plus.
Okay. But there's not like
that
a state, I think so, but there's not like a state-run Medicaid offering. The Medicaid offerings are through, or is there another option out there too?
For the enhanced
there is.
Medicaid.
Okay.
Oh, yeah, Mary, I'm not sure I heard. And
For the enhanced Medicaid, it's
Oh,
Blue
right.
Cross or Blue Cross of Idaho or Molina for the enhanced Medicaid, and then you have basic Medicaid. You have the CHIP, program.
And that's all
Those are
still separate.
Yeah,
Okay.
but
Yeah.
for between our plans, between Blue Cross of Idaho, what Kristen is speaking to, and Molina Healthcare of Idaho, that's for the enhanced Medicaid.
Okay. And the eligibility that you were talking about was the enhanced, is that the eligibility for enhanced? Am I thinking about that the right way?
Well, so we don't determine between basic and enhanced. That's done within the walls of IDHW, of Department of Health and Welfare.
Okay.
So the members should know. If they don't, we can give them a number to call. So yeah, once that determination is made by Health and Welfare, then we'll know, if they're enhanced or basic. If they're basic, then they just don't qualify.
Okay.
And Dara, I'm not sure if you were getting to this, but if you can see on this screen, so all of those counties that are grayed out, those individuals, if they're dual eligible and they live within the grayed out areas of Idaho, we don't have service there. So they're still on traditional Medicare and Medicaid. So that system is still operating out there. But currently, Blue Cross and Molina are the only two that offer the coordinated care plans in partnership with the Department of Health and Welfare, and we have that level of oversight in that contract.
Okay, now I'm clear. Thank you. Sorry,
Yeah,
it took me a while to.
It does. It's a lot to take in, and every time I speak to it, I keep thinking, oh boy, I have new illustrations of how we can do this and how to really explain it, because it can be a little bit complicated. And I think once we have better coverage throughout the state, it'll be a little bit more clear, but we're still just growing. And so it's a little patchy. So there's a lot of pieces that are floating around. So yeah, feel free to ask questions or reach out to Mary and I with any questions that you may have. And I'll just get to the back here and yeah, open for questions, thoughts, concerns.
Well, one comment I do want to make, Kristen, to kind of dovetail off of what you just said, in the fact that it is complex and it is complicated. Now, think about if you're in a situation where you're that member, you're that person, needing this, and you look at, how confusing it might be for us, on this call today, but then you have medical issues, maybe you have behavioral health issues, you're thinking about finances, where's my next meal going to come from, all of those kind of things. And, that I think is a perfect illustration of why, this coordination, piece is so very important.
That is so true. And yeah, what Mary said, it streamlines it all for the member. It makes it easier. It's a difficult thing to illustrate and to talk about, but really in the end, what matters most is it's just easier for the member and for their families or caretakers to manage that piece, because you've got some professionals right there behind them that are in the system and that can just help. So
it's really a higher level of service to those with the highest need, right? If you think about it that way.
Excellent. Yeah, that's perfect. I'm writing that down. It's a great way to say it. Yeah, thank you, Dara. And
every now and then.
It was perfect. Perfect. And I'm sure you'll get my number and email with information. I can definitely give you my number right now. It's 986-224-3045. I'm Kristen, and I'm with Blue Cross. Mary, I don't know if you want to give them your number if they want to know more about Molina.
Sure. I'm located here in Boise, but I'm going to give you a non-Boise number, only because I haven't changed my number when I moved from Colorado. It is 720-217-3703.
Okay. And I think what I will say is, since our presenters today have been so gracious in sharing their personal contact information, since you're all on the phone, I'm going to say this: when I send out the post-meeting information tomorrow morning, I will include your contact information in that email that goes to all registered attendees, because I know that some people do register with the intent that they will then be notified when the link is available to watch it if they can't make the meeting. So if that's okay with all of you, I will do that. And any other questions from anyone for any of our presenters today? I think we can take any additional questions. And if there are no more questions, we're right about at time and the perfect time. And I want to say thank you very much to Teresa and Kristen, and thank you, Mary, for the additional commentary and joining us as always to share. This is a really important topic that really, Medicare and Medicaid are designed for our most vulnerable population, and whether they're your family member, yourself, or your client or your customer, I think this kind of understanding of better understanding of how to navigate is so valuable. And while I know that I will benefit from this as a professional, I plan to take nuggets back to my father-in-law and my neighbors, and eventually I'll be needing this myself. So I just value this education so much, and thank you all so much for sharing your expertise and wanting to help people make the best decisions possible. And of course, thanks again to Life Changes Elder Care Consulting for sponsoring today's event.